You are watching the DocTalk show.
Welcome back. We are discussing a condition that is very common in pregnancy. This condition is called preeclampsia. It basically means the lady's blood pressure is very high. And we have learned that very high blood pressure can result in so many complications, both to the mother and to the baby. To the mother, it can cause organ damage like kidney injury. It could cause stroke and it could cause death to the mother. And to the baby, it could affect the baby's growth. So the baby is most likely to be born as a premature, or might have very low birth weight, or may not be alive at the time of delivery. So preeclampsia is a big condition in pregnancy, and this is why it's important that we understand how best we can manage and treat this condition that seems to cause so many deaths to both mothers and their newborn babies. So with me in the studio are the experts in the field of preeclampsia. So the problems can be short-term, causing damage to the brain and to the kidneys, on top of posing a risk to the mother's life. Or they can be long-term. It means even after the pregnancy, after delivery, some years down the road, they can still cause a risk of high blood pressure, or a second pregnancy having preeclampsia, or even strokes occurring later in life. Okay, so but these are mainly to the mother. Could there be certain complications to the baby?
To the baby.
Dr. Mugisha?
Yes, so we had said the focus, so the origin of this is really placental. So when there is that an abnormal formation of the placenta, at that level, you will have reduced supply to the baby. So the baby does not get the appropriate amount of nutrients and the appropriate amount of oxygen supply. So in due course, we tend to see low birth weight babies being produced, pregnancies that have to be terminated sooner than they should be. So we end up having preterm births, and these might have long-standing sequelae, neurological sequelae, disabilities with these children later on. Not to mention stillbirths, and babies die even either management or actually as a consequence of the actual illness.
Okay, so a problem of the placenta, much as it will cause high blood pressure in the mother, it can compromise the child's growth. So the child might have poor growth, and thus is either born as a premature baby, or can be born with very low birth weight, or in the unfortunate bit, they can also lose their lives in the process. That means the baby is either born when it's not alive, or it might cause some kind of miscarriage or abortions. It seems to be a very common condition worldwide, both whether it is abroad or whether it is in African setting. Preeclampsia is common. How best is it managed? How can it be treated?
So the key thing about preeclampsia is this: once the condition has started, it's not really curable. The only cure is when the placenta is delivered, when the baby is born. But the key point is that, one, it's identified early, and then secondly, it's managed properly. So although we might not be able to prevent or cure preeclampsia, we can prevent it deteriorating into its very severe form. In its early form, it can be manageable, and the mother can have a good outcome, the baby can have a good outcome. Once it's deteriorated into its severe form, it becomes very, very difficult to treat indeed. So one, the identification is important, then the management. The identification actually on paper is very easy. A woman may or may not have symptoms, so she complains of symptoms, and then taking the blood pressure is not a very difficult test to do compared to many tests in medicine. So identification can be easy in the antenatal clinic, and then management in the first part is with medicine for the blood pressure. I don't know if you want to talk more about that.
So you're saying for when it comes to treatment, the most important bit is if it can be detected early and fast enough.
Yes.
Because of the so many problems it results if it goes undetected.
Yeah.
So we detect it early and then start the appropriate treatment. Okay, so Dr. Mugisha, is there any specific treatment for this preeclampsia?
So as we had looked at earlier, the problem is placental, and ultimately delivering the placenta. The baby and the placenta is curative if that was to happen. The dilemma comes when we actually need to increase chances of survival for the baby and also, minimize complications for the mother. And that really puts us at a dilemma with our patients. When is it optimum? So the good management patient would be one where the baby is fully matured and with its onset we deliver immediately. But in scenarios where it comes a bit earlier, we are pushed to the wall to try and prolong the pregnancy a little bit, just to give our baby a chance to survive and also keep monitoring the mother so that we really don't have a lot of onset. So the conservative treatment or the management we try to administer to prevent aggression or progression into the severe outcomes would be, controlling blood pressure, as we are saying. So the blood pressure medications you will be putting on, and the meticulous monitoring, because there is a range of blood pressure we really want you to keep within. We will try to minimize prevent convulsions from setting in. Convulsions, these are fits, just fits women will get that could really have far-reaching effects in the brain. So we give a very painful injection women usually get. Given there are other managements really to help the baby mature quickly the lungs. So we give some steroids to the mother that are transferred later to help the baby really hasten. So that buys us some time for the baby to mature, and then we can have delivery.
Okay, so when you talk about delivery of the baby and the placenta, it seems to bring a state of urgency that the pregnancy must end in order to stop this condition from happening.
You are watching the DocTalk Show.